Preparing for live stream.
And then I have to remember to turn this thing off. All right, cool.
What thing?
Because it'll play here and here, and there's a delay.
Oh, that's confusing. Yeah, we can't have that. Preparing for live.
See that? Hi, Swole Sisters.
Worldwide. All right, exciting.
Welcome.
This is our first ever guest on Facebook Live.
Yeah.
And I'm really excited to have Michelle join us, who I met briefly. I had a little interview to possibly train her, and I trained one of her, what do you call her, a co-worker or a business partner?
Colleague. Yeah, she's my business partner.
Yeah. So, but when I talked to Michelle, I was like, she gets it. Like she, you know, I felt like we were on very similar brain waves for what was going on with things. So I was really excited. So, and just as an introduction, I did, share this in the Facebook group. But Michelle is a licensed clinical mental health counselor in Colchester. She practices both dialectical behavioral therapy and eye movement desensitization and reprocessing therapy. She works with a wide variety of clients and has particular interest in the intersections of family, sexuality, and faith. Recognizing that dieting, weight preoccupation, and food rigidity were interfering with clients' progress and preventing them from living full, embodied, integrated lives, as well as stealing her own well-being and joy, as it does. Michelle began a personal and professional intuitive eating and anti-diet journey. Michelle now works with all her clients to nourish and strengthen their bodies. Oop, I just did something stupid, sorry. To nourish and strengthen their bodies from a position of gratitude and acceptance and intuition. She's also an avid weightlifter and strong advocate for strength training, particularly for women. Yes, we love all those things.
I love all those things.
That's so great.
The thing about us being next to each other is our very different volumes.
Sorry,
I'll true.
I'll try to speak like a normal person.
I could try to up my game a little bit.
No, Jen. You just be yourself, Jen. Be yourself.
My normal half asleep.
But do
self.
put your head closer than mine. Here we go. So we can have head equalness. Okay.
So Michelle, I would love it if you would just kind of like go through what your experience has been with exercising and diets and how that has evolved through your life.
Yeah.
In 5 minutes. Or
What
less.
brought you to this place? What brought you to this place of anti-diet like wokeness?
Yeah. Well, I never really considered myself a dieter, although I did oftentimes like count calories and things like that. So I think recognizing that I had dieted was an important step. That counted. That it's not just like fad diets and celery juice, that it can just be straight up restriction. That seemed like a way to do it in a healthy manner. Like I always did it in a healthy manner, and recognizing that it's the same exact thing, that it's just packaged differently. But I mean, it took me a long time. I started weightlifting maybe 8 years ago. And what's interesting to me is like that always felt completely separate from food and body changes, that I was eating to support that. Like I was eating more, and I wanted to feel good the next day. So I wanted to eat carbohydrates the night before. Like I wanted, that it felt very divorced from diet culture. And times where I was restricting, like weightlifting was not fun. Like it sucked. So that was definitely a motivator to start eating differently and to be focused on some different goals. But for me, it was really my clients, and that I have seen clients since the beginning of my career who wanted to lose weight, and I was trying really hard to help them lose weight, and I was doing all the things and following all the CBT approved, all the stuff that's really healthy, really good, really good for you, and they all felt bad. No one felt better, whether they lost weight or not. It wasn't actually shifting people's body image. And I've worked with clients who've had bariatric surgery and it did not shift their body image, or it didn't change the health symptoms that led them to seek surgery. And I was like, oh, this sucks. Like these are, from drastic to small measures, like this just seems like a waste of time. And so I really shifted my therapy practice and started incorporating more intuitive eating and quitting working with clients to lose weight, but wasn't really doing my own stuff. And so it started to feel really bad to watch my clients progress and start to feel better. And I was still had the restrictive mentality, but was eating all the foods. So that went on for a long time with like that. I just felt bad about what I was eating, but I was like, no, it's fine, but I shouldn't have, but it's okay that I did. And was kind of doing this dance after every meal. And then finally was like, okay, I have to like break up with diet culture, and sat down with myself and like really thought through like what are the steps yet to take, and what are the things where I'm not really committing all the way, and then did those things.
What were the things for you?
Throwing away the scale. Like I still had it in the basement. I wasn't using it, but I had it just in case. Thinking through at the end of the day all the things that I had eaten, even if I was like, it's totally fine, all those things are fine, like just the act of recounting them didn't work. Buying a lot of new clothes, like figuring out what my style was at this body, not just buying clothes for this body, but actually like what looks good on me and what feels good. And then also just talking more about it, like talking to my friends. Like it was something that felt really isolated. Like it was something that's like, well, this is okay for me because I'm fat, but I can't talk about it with my friends. And then being like, no, this is okay for everyone. This is good and healthy for everyone. And I'm allowed to talk about it with everyone. So those are the things that come to mind.
I love that you talk about straddling the fence between diet mentality and the other side, which we can kind of call more like weight neutral or HAES or intuitive eating, whatever. Because I think that ambivalence is so normal. And I think it's such a tough place to be because you sort of know better, right? Like cognitively, you're like, I know this isn't, I know like we can all get on board that this is not good or this is harmful, but we're still kind of holding on. And I think that's such a powerful place to just recognize that we're there, and then like what kind of pushes somebody kind of over to the other side, because straddling that line, I think everyone has to go through that, right? Like if you're going to be practicing weight inclusivity and health at every size, intuitive eating, we all have to go past that really uncomfortable point. So I love that you shared that, because I think a lot of people that are in the Soul Sisters membership are at that place. And it's just, and I think there is that kind of almost feeling of guilt. And I know for my clients, sometimes they're like, they feel guilty talking about, the fact that they still have fantasies of losing weight. And I'm like, don't feel bad. That's so normal. And we are completely just saturated in diet culture. It would be weird, honestly, just to have you suddenly not care about that, or to suddenly, right? It's like, it's a process, and It's human, and it's nothing to be ashamed of.
Yeah, I like that idea too, that like your behaviors have changed, but the thinking hasn't changed. And there was like a little bit of time for the two of those to match up. And I feel like if you notice, that's pretty normal when somebody's making changes.
Yeah. Yes. Or they'll think they're changing the behaviors, but they're actually just doing different dieting behaviors. Right. So it's like, well, now I'm just walking for my mental health, but if I lose weight, that's great. Like, and so like they'll kind of, which I've done that too, where like you kind of shift the behaviors and you're like, yeah, I'm doing it. And then you're like, oh shit, like I'm not doing it.
The secret reason.
Yeah. And I think for me, like framing it as a relationship with diet culture was really helpful, because then it makes sense. Like if you break up with somebody and then you're like out in the world and someone's like, have you seen Taylor? Did you see what Taylor's doing? Taylor's doing this. Are you interested? And people are constantly bringing your ex up. Like, of course you're not going to be like, I'm over it. I'm healthy. I'm past it. Like I never think about it, because everybody keeps bringing it up, and you can kind of trick yourself to be like, well, I'm just checking like the Instagram, just like, so that I know like if they've left town. And so if I know if I run into them, but that's not why. And so like starting to figure out like, why am I actually doing that thing, and really reckoning with what the goal is.
Yeah, the motive. I talk a lot about like the motive is more important than the actual action itself, because I had a discussion with a client recently about vegetarianism, and how I'm like, hey, like there are many wonderful reasons to be a vegetarian, and then there are other reasons that maybe are not serving you overall the best, this person is a vegetarian for what we would call, I don't want to say like right and wrong, but ethical reasons. Thank you, Jen. But yes, but just that motive is just so important, and only we can really know what that is too. So I just like briefly on a tangent, I'm just like curious about your education and how you how schooling wise you were maybe trained to help people lose weight. Like, how was that part of your education? Like, what did they suggest for situations like that?
That's a really good question. I can't remember it ever coming up in my graduate program. I remember things like, don't be sizist, like type things, but I don't remember ever actually getting into the meat of it. And maybe I wasn't paying attention to that. Maybe I, was not ready to talk about that. I don't remember there ever being explicit, like, here's how you lose weight. I think a lot of that has been like places I've worked or, just, people I've met professionally or whatever that have strategies. And honestly, my own personal education, my own research, my own looking into stuff. But I think it was kind of an absent topic, which is problematic. It's problematic for personal trainers and nutritionists and dietitians as well, that not talking about it is just agreeing to collude with the status quo. But yeah, I don't remember. Yeah.
And feeling as though almost it's just this thing that as women, we're just supposed to accept the fact that we all want to lose weight. Every woman just wants to lose weight, and we all are going to be unhappy with our bodies. And that's supposed to just be a part of our culture almost as women. And bucking that trend is really difficult because in a way, just similar to that and being in a doctor's office and not, unless you look emaciated or you look like you're really outside of the whatever BMI, no one asks what your relationship with food is like or your relationship with your body. And I think that that's such an important question, how different the world would be if, doctors just asked everybody that question.
Yeah. Well, and I think to what you were saying too, that I think there's a confusion between like the behaviors that are helpful from mental health and behaviors that are motivated by having a smaller body. And I think that did come up in my educational training a lot of like, here are the things that help people feel good, but it actually wasn't, because like the things that help people feel good are not running for a lot of people, and we can talk about like movement, but that's different than exercise to lose weight.
Okay, so you felt like it was a little bit weight centric then?
Well, yeah, like a little bit, like those things were kind of tied together. That again, like weight loss would be a helpful like bonus. And I have a lot of clients who come in with that mentality that they've been told by their doctor or friends or whomever that like, well, but I should be restricting my eating and losing weight and exercising X many minutes, X many times a week. And then having to kind of reframe that as like, well, there are some things that support mental health, like again, like movement, but that could be sex, that could be walking, that could be dancing, that could be cleaning the house, that could be chasing your kids around. That we know that getting your heart rate up is helpful, but that doesn't have to look this prescribed way. And the same with food. It's like, well, yeah, foods can make you feel better and worse, but what seems to be, the biggest factor is nutrient timing and skipping meals. That's going to make your moods just be all over the place. And that's not like, more restriction doesn't help with that. So I think there's a lot of confusion that I see in like the mental health field and just in clients in general about like the difference between behaviors that support mental health and behaviors that are designed to lose weight and conflating the two.
And the idea that if someone is eating intuitively, nutritiously, listening to their body, moving intuitively, has all these pillars of health pretty well balanced, that they're going to be thin, which is also not true. Yes. And I think that that's such a massive, that is such an issue. And because when people maybe are moving towards better individual health, they may feel like they're not doing it right because they're not losing weight, or maybe they're even gaining weight. And that's part of them reaching, where, they are going to feel the best and where their health is most optimal for them and their bodies. So yeah, that's a really tough one to overcome in the culture, I think.
Yeah.
Yeah. Yeah.
So like, how do you feel like your counseling has changed, you know, with this change that you've made for yourself and for your, do you call them clients or patients?
I call them clients,
Okay.
but either is fine. I think I get a lot more, I'm a lot more confrontational when it comes to food. Like I don't accept the first answer. So if someone says, I want to lose weight, and I ask, what's motivating them, and they say health, like, I'm not like, oh, okay, well, that's a good reason, so let's do that, and I feel like I used to do that, like, oh, you have sleep apnea, so of course, yes, let's lose weight. That now I'm like, well, what does that mean? Like, what would be different if you were healthy, and what does health mean to you, and what are the things that you would do when you're healthy that you're not doing now? And like, I just ask a lot more questions and drill deeper to what their goals actually are for wanting to be healthy, because that's how it often presents, is wanting health. And I'm also explicit in saying, like, I will not work with you on weight loss. Like, I just know. And I've lost clients as a result, and I've had people get pretty mad at me and work through it and come out on the other side. But I'm not willing to. And there's then like a dance there of like, I am willing to work with you on shifting health behaviors. But then we really have to get clear on what those health behaviors are for that individual person at this individual time in their lives. So yeah, a lot more confrontation. And then I think a lot more like just giving resources and being like, read this or listen to this podcast or access this thing, and then let's talk about it, but let's table this for now. And not necessarily putting myself in the position of being the convincer, but just kind of setting my own boundaries about, here's what I think isn't ethical, and being honest about, like, here's why I don't think it's ethical. Here's why I think it violates my, professional obligation to you. And then letting them kind of.
What would that be? What would you tell someone in that case? Like,
because it doesn't work. That it doesn't work in terms of losing weight. Like, intentional weight loss is not effective over time. Statistically, obviously, there's always outliers, but it's not reasonable. And I say, if it was any other therapy intervention, we would say it's a failed therapy intervention. It doesn't work. We should throw it out. So like, it's not effective at weight loss. And there's so much other more important things to work on in therapy. And I think for me to say, let's help you lose weight, is to completely lose sight of like the triage of mental health, of like, that's not going to lead us to the best benefits. That like, we need to be working on the things that actually lead to high quality outcomes, and the things that are research based to lead to quality therapy outcomes. Like, I want to do therapy. I don't want to do something that doesn't work. Like, I'm obligated to do things that I think are effective and work. And I don't believe in it. And we know that the importance of the therapist believing that the interventions that they're using will work, like, that's critical. So you need the client buy-in and you need the therapist buy-in. So if we don't have my buy-in, it's also not going to work. So there's just so many reasons why it's just not effective. It's a waste of their valuable time and money. Yeah.
This might be just going down too deep a rabbit hole, so just tell me, but, and I hope it's not too obvious either, but in your opinion, why do you think that, and I'm just going to speak for women and femmes here, but that we scapegoat our bodies the way that we do, instead of, dealing with the real issues, so to speak. Our bodies kind of become this manifestation or this scapegoat for us. I hope that, anyway, I'm just going to let you know.
Yeah, I mean, I think we're told in so many ways by so many people across our entire lifespan that our value is in our bodies, and that if we are not pretty, nothing else matters. That nothing else that you can offer to the world or provide or produce is significant if you're not attractive to men. And so I think when we're scared or vulnerable or threatened or things aren't going well, it's really easy to go back to, here's the thing that would give me value. Like, okay, so like, I hate myself. Well, I know that the thing that matters most about me is my appearance. So if I can modify that, and if I can have, this currency, then maybe I won't hate myself. So like, I think it's kind of like, why do we why are we desperate for like parental approval? Even if we know that our parents are not ever going to provide that, or the relationship is toxic, or there's abuse involved, or whatever. It's like, we've been told that relationship is primary. Like I don't know. I haven't thought about that question, but for me, it's like that our worth is in our bodies.
Value and power too.
The power,
that's one way to have power. So
absolutely. And if you're feeling like bogged down by sexism or whatever other, social forces keeping you down, like it sucks to also, live in a body that's not recognized as valuable. And so that feels like something that's modifiable. So if you're like, okay, I'm sick of all of these things, but I can change this thing. There's the illusion of change and choice in a way that there isn't if you're struggling with, being treated differently for something that doesn't feel changeable.
Right. Like that, some things might feel just so insurmountable, but when you flip open the Cosmo and it says flat abs in 7 days, you're like, now that's
I can do that.
Get on board with.
And it's like measurable. Yeah, like what's
Yeah.
more measurable than your weight or your clothing size? Like as far as working on mental health stuff, it's hard to be like, I feel better about myself. My body image is better. Like it's hard to measure that. We find that that's a real struggle for us in selling personal training without selling weight loss, because they tell you when you're learning how to market yourself that you need to have like measurable goals, and it's really hard to offer that like carrot to somebody. Like your measurable goal is that you're not going to think about food in your body all day long. You're going to think about other things.
But
finally.
when will that happen? It's very
Right.
hard to know, and it really depends on the person. And yeah, I know we should market. We should look into how therapists market and choose that marketing. You know what I did create though is a signs of growth kind of just worksheet.
I like that.
It's like it just has
An assessment.
Yeah, signs of growth that somebody could have, and looking over a day or a week, so even for instance, noticing judgmental food thoughts would be a sign of growth, because hey, like, okay, maybe you are judging yourself, but you're noticing that you're doing that. And that's important. Having that awareness is important, like really graspable. Some of them are a little more in depth, but so I thought that was kind of a cool idea to give to people.
I love that.
Well, I also I thought when you were speaking, this is like, could have been 10 minutes ago now, but about how you think that sharing knowledge is kind of powerful, and you say, hey, okay, read this and let's discuss it. What are some of the resources that you point people towards, whether it's like people follow on social media or a book or podcast?
At this point, it's a lot of podcasts. I find like people have been more willing to do that. So I love Christy Harrison's podcast.
Number one.
Food Psych for sure.
About these that you say, go ahead.
And Food Freedom Body Love.
Yes, Jen turned me on to that.
Yeah.
I heard that one. I like her.
I like her a lot. She's super direct and confrontational, which I really like.
Yes.
And for people coming from more of like a fitness background, I like Steph Gaudreau's podcast. Great. And Achieve Fitness out of Boston also has a podcast where they address some of those pieces as well. And pretty like it's a couple that runs the gym, and one of them talks about her personal experience with getting to the other side. And so those are the ones you usually start with. And then there's a podcast, I forget what it's from, but the premise is, but what if losing weight would help with my blood work or, health issues? And that's one that I often start with, because that's usually the motivation, like, well, my knees hurt, so I have to lose weight. And just like that sometimes gets us past that stuck point of that is the only thing that could possibly manage my symptoms.
Right. That's great.
Yeah, we see that a lot. That one's a tough one.
It is tough.
It is, because we're also up against doctors and newsflash, I'm not a medical professional. And so that is a hard one to contest.
Yes.
Because
and even if it's true, I think that's the hard part too, where it's like, well, even if it's true that weight loss would help with XYZ thing, intentional weight loss doesn't work. Right. So this is a waste of our time. Where, our time would be much better spent working on acceptance and accommodations and moving around whatever the symptom is. And like that's actually going to lead to more peace.
Yes.
Than failing over and over.
Yes. Yes. Do you have sets of questions that you're asking, or can I just ask questions?
You can ask questions.
No, you go though, because I asked the last question.
Oh no, so I thought it was interesting. We were talking about the topic of emotional eating before we got on. So I just, would love to hear your thoughts on emotional eating.
Yeah. Yeah. I have grown into a pretty radical perspective where I think emotional eating is not a problem. I think it's a neutral behavior. And that's, at least in the mental health world, very radical. I don't know if it is in y'all's. But that that's another thing that I am starting to get more convicted of. Like, I don't think I'm willing to treat that as a therapist. The thing that I am willing to treat is if food is the only thing that provides comfort, peace, pleasure, whatever it is that they're seeking. Like, I think that we all need diverse strategies because we might not be able to access that one strategy. So I treat it the same way that if someone, we were talking about, if your only thing is yoga and yoga is the only thing that helps you cope with difficult things, that's not going to work. Like, you're going to sprain your ankle at some point, not be able to do it. We need multiple things. Or if someone's only thing is talking to their best friend, it's like, that's great. You need more things than that. Is that your only thing?
No, I've got Justine. I don't need anything else. I have Justine and tennis.
So there you go. 2 things is plenty. And so if someone
potato chips.
Yeah, so 3
things.
But I think that the issue with emotional eating is the shame that's felt after the fact. And there's an entirely different set of strategies and interventions to address shame. That's a different therapy goal than reducing emotional eating. Like, emotional eating is neither good nor bad. And people say, well, it's bad for my whatever organ. It's like, so is shame, so is stress, so is like all this anxiety that like we can't parse out and compare which thing is better or worse. But I do know that when we try to reduce the emotional eating, it usually doesn't work. When we try and address reducing shame, that usually is more effective. So like, it makes sense to take that perspective. So I don't think emotional eating is bad. Right? Get your chips.
Thank you.
And I think in there you made a great point in that we always think of, like, when we're talking about like, oh, fixing all of these things for my health, but we forget that things like shame, guilt, social isolation. I feel like dieting causes like isolation. Like, all of those things are also bad for your health. So like, it's like swapping one thing out for the other.
Absolutely. And I have clients who won't do the things that they come to me not doing the things they want to do, that they're waiting to lose weight. And we're like, okay, but if, like, I think of one client in particular who's like, I've always wanted to hike, so I need to lose weight so I can hike. And it was totally revolutionary when I was like, what if you just started hiking at the weight you are? And she's like, oh. And so she started hiking and didn't lose any weight, but like, she's doing something that she loves. So exactly what you're saying, that like, the benefits of just doing what you want to do, living your life, having more peace and ease, like, those are health outcomes as well. Because stress, we know stress is so bad for you. So if you're stressing about your emotional eating, like, well.
And the distraction, I mean, I can recall vividly being out to dinner and being very distracted by, what is she eating? I really want to get this, but I'm not going to get this. I'll just get the salad. Well, maybe I will. I don't know. Okay, I'll just get a side of fries. Oh, I shouldn't have ordered that. Like, that was my mental chatter. And it made it really difficult to really connect.
Yeah.
And I was having, this quality social experience because I was so in my own head, distracted with the food. And just before I forget, I think it's such a difficult thing to wrap our heads around when we have this. Again, most people perceive emotional eating as negative, and they point the finger at the foods, right? They're like, well, clearly I can't have this food in the house because if I do, like, I'm just going to eat all of it as soon as I come, or whatever. And it's so interesting that it's like the food isn't the issue at all. It's the shame, right? Or it is, like you're saying, it's the issue might be a lack of diversity within coping mechanisms that we have available. But again, I just had this discussion with a client. I talk about this pretty frequently in our culture. We just completely put all of our, I was going to say, put all of this weight in, which I'll say that, no pun intended, but into exercise and food as like the only pillars of health that matter. That's it. Exercise and food, that's it. Like this idea that we could eat a certain way and we're like never going to get sick and we're never going to die. Like we just could eat this certain way. It's a very much like almost this fountain of youth or this like this magical thing, and not realizing all the other pillars like we talked about with the stress and the sleep and the social and everything else. It's such a major issue.
Yeah, like the time I decided to be vegan,
that's so
because
weird.
I thought that it was going to keep me from getting cancer and keep me disease free. But it also turned me into an insufferable asshole. So I didn't have many friends, and
so you don't have friends, but you won't have cancer. Like, is that?
I had stinky bean farts, so nobody wanted to be around.
Well, no,
me.
but when I was on my paleo kick, I mean, that was really huge. I was genuinely afraid, and I have a parent that passed away from cancer, and I really was like, oh my God, like sugar feeds cancer. Like I like read articles about, about that. And I was genuinely fearful. And then of course, and then you like lose weight. Oh, cool. Like, but of course that was a major motive. That was also a major motivator. I'm not saying it wasn't, but there was a genuine fear and anxiety around, I'm just not eating right, here's the right way. And this is really going to change everything for the better. And obviously it does not.
It's the illusion of control again.
Right. Absolutely.
Like I can prevent myself from having cancer if I eat these things.
Right. Exactly. The other thing I wanted to touch on with you is this, it's not on the DSM, but the concept of orthorexia.
Yeah.
And if I don't even know if you can answer this question, but if you're seeing that pop up more or
and maybe just explain what orthorexia is too.
Yeah, and I'll also say I don't specialize in eating disorders, so take everything I say with a grain of salt. I'm more general population, have other specialties, but the intersection is, most of my clients have food and body concerns. But orthorexia in general is rigidity around the foods that someone eats. So it could look a lot of different ways. So it could be vegan, it could be paleo, it could be neither of those. It could be only organic, it could be all sorts of things, but there's certain foods that are okay and certain foods that are completely off limits and bad. And usually the motivation is some sort of health adjacent, like keep fear of cancer, wellness, or sometimes just this is the right way to eat and the wrong way to eat. But there's intense consuming anxiety if you step outside of that and eat one of the like not okay foods. I think for me, like the line between that and just like the average American female is so tricky. So I'm like, yes, I feel like but like I don't know that I personally have seen a lot of that rising to the level of meeting the criteria for that disorder. But if someone did have eating concerns rising to the level of the DSM criteria, they would be seeing an eating disorder person.
It is a gray area. Like it's interesting because like you're saying, there's that gray area between like eating disorder, disordered eating, that spectrum. And I think that the new sort of obsession of clean eating, and that there's this, and there's a lot of superiority around it too. We talk about control, but there's also, and I will confess to this, when I was in a place of eating a very specific way, you're admired for that because it's so disciplined. And there's also like a level of superiority that like I'm eating correctly and all of people are eating like incorrectly. That's
there we go. Got it.
Got that one on my own. So it's a complex issue, but I have, when I work with people and try to help them make their way through intuitive eating, that's a big concern, is like this idea of, but isn't just like Fritos are unhealthy though, right? And like I don't eat them because they're right? And it's hard, even when they say it, I'm just like, even myself, I'm just like, how can we get over this hump?
Yeah. And I think for me, like working with clients to actually let go of the words healthy and unhealthy and acknowledge like what they're saying is good and bad. And so then if they can hear themselves say, but aren't Fritos bad? Then they can be like, okay, well, that sounds kind of silly. Like food's not good or bad. But I think like the healthy and unhealthy can just be such like a cover for all of it, all the junk.
Yeah,
Mhm.
yeah, absolutely. So what would you say instead? Like, you know, like I still try to encourage people. We kind of talk about nutrition by addition. Like, let's
Yep.
add some, you know, and so I try to say like nutritious foods or nutrient dense foods, like
Yeah,
in there.
that's a great
That's
question.
kind of the wording that I use.
Yeah.
Nourishing.
Yeah.
I don't use a lot of those words. I think I talk about having a more diverse diet. So like if someone's eating a lot of the same things, whatever that is, but I stay out of recommending specific foods. Like I have clients who are perfectly healthy that eat a lot of things I wouldn't eat. You know, like a lot of foods that we would consider unhealthy, but their labs are fine and their mental health is improving. So what does it matter? So I think I just kind of step out of that there's like, I think it's true that there are nutrient dense foods. I just don't find myself saying that a lot. Sometimes there's a specific food group, like you're saying when you were vegan, that didn't work, like something was missing. And so I'll talk about what's missing, what nutrient might be missing, maybe talking with a dietitian to see what nutrients might be missing and adding those specifically. But I stay away from adding in more nutrient dense food.
Like just eat a little more fiber.
Yeah, but I think you bring up such a great point around just the genetic diversity of what we require macro and micronutriently. Yeah.
Mhm.
Because, you know, it's funny, my partner, he's from Bosnia, and he gets kind of obsessed with eating fruit. He's like, I really should eat more fruit. I should eat more fruit, because when he was growing up, they didn't eat like a ton of fruit. There was a lot of like meat, potatoes, stews, pickled things, salads, soups, things like that, just like not a ton of fruit. And I'm like, you might like not need to eat fruit. Like,
Yeah.
you know,
Yeah.
your parents are healthy, like everyone's doing.
Do you like
fine.
fruit? I think that's it. I focus way more on like, what do you like and what don't you like? And usually that's a process of like trying foods, and both forbidden foods and just foods that, you know, forbidden that they've forbid themselves, or just foods that they haven't tried before, of like, if you like fruit, eat a lot of fruit, like right on.
Sure.
If you hate fruit, don't eat it. And
But
so I think a lot,
back to like that idea of like what's motive, like why, like I could see you know, somebody's like, I really should eat more fruit. It's like, why do you think that?
I think another one of those like expressions that's like really like covering something else up is, well, I don't feel good if I eat that, or I feel bloated.
Woo! Yeah. Dairy,
What do you think about that?
Make everybody feel. I think that, well, and I will also say, like, obviously there are things that make people feel bad. Like there are people that have intolerances, obviously. And I think that there are nutrients that might be missing in someone's diet. But again, if their lab work is showing like, oh gosh, you need more iron, like by all means, eat iron containing food. But in the absence of there being a symptom that it's a problem, that's where I'm like, well, why is it a problem? But yeah, I think a lot of the folks who are experiencing intolerances are actually experiencing the effects of shame, and the effects of anxiety. And those both are very bodily. Often you have stomach discomfort. Often you feel lightheaded or dizzy. Often you might have a headache or feel pain, or you might feel heavy or weighted down. Like, and those are the same things that people are describing when like, oh, well, that happens when I eat dairy. Or gluten. Those are the common culprits, but I'm sure other ones exist. And I think that we have to kind of address the shame and anxiety piece after the fact to know if the food is actually causing that, or if that is it's a real response. It just might not be because of the contents of the food. And I think, like often that this thing makes me feel bad is like, well, the food is bad, so it must make me feel bad. And so decoupling that to be like, well, once we get the food to be neutral, then we can reassess whether it makes you feel bad.
And once the food is neutral, like what you're probably going to slow down when you eat it and eat like not eat as much, because the restriction leads to like eating to discomfort a lot of times.
Absolutely.
And the shame. Yeah.
It's so true that like if you're eating like a whole pint of ice cream, you might feel bad because your stomach is full. Right. And like that's different than dairy makes me feel bad. Like that's just a completely different scenario.
I love that. God. It's so new. It's like, it's so, when you say it and we're in context, it's like, duh. But but sometimes but these concepts are really hard to grasp in the moment sometimes.
Well, again, like the world is working against us. Like, I think that's the thing I think about a lot is that, like the more I've been aware of my own feelings and reactions, the more I'm like, it's everywhere. Like I was reading a book about like healing racial trauma, and the writer was like, well, if you're more than 10 or 20 pounds overweight, that's going to have an impact on your joints. And so you should be eating like whole grains and switching out all your fats for like healthy fats. And I was like, why?
It's crazy because like this whole like thinness thing is like ingrained with racism.
It is racism. Yeah, exactly. And so then I'm just noticing like all these places where it comes out where I'm like, even you? Like you?
Oh my gosh, I think it was Beauty Redefined that just did a post saying how even Brene Brown and Oprah are in diet culture.
Oprah really is.
Yeah.
And I love Oprah.
Oh yeah, she's always been a Weight Watchers post.
I know. Yeah, that's true.
But Brene Brown is like, she's very low carb keto, and she's always talking about how she can't eat carbs. She doesn't. Same thing. Like, I just don't feel well when I have them. And I'm like,
well, and her books, like some of her books, we if you read them, there's some fat phobia in the books for sure that it's really tough to read. For me personally, tough to read.
Then it's like, if your recovery from diet culture is in any way like fragile or compromised, like that stuff just knocks you back down. And so like, I think that's the tricky thing too of, you know, it's, I feel like it's different even, you know, if somebody's struggling with, well, I'm not coming up with a good analogy, but where like, you're just constantly reinforced for like we talk about eating disorders are one of the only, you know, mental health disorders that you get reinforced for, that people praise you for, that and you get punished and shamed for not buying into that, right? Like you go to your family and it's like, oh, you're not gonna not eat. Like it's everywhere. It's everywhere.
I mean, I think alcohol is similar. You'll see it like in movies and like everybody.
It's glamorized.
Yes. Yeah.
Glamorized. Yeah.
I think that's something.
But I also feel like we mostly have a cultural agreement that if someone says I'm an alcoholic and I don't want to drink anymore, that most people are like, right on. Mm-hmm. Right. But if you say like, I'm breaking up with diet culture because it's ruining my life, people are like, well, do you know, like, I feel like you still get pushed back for, do you know?
Because of that health aspect and the fact that our industrial complex, like, and the medical establishment is still firmly entrenched in this idea of fitness as health, and that makes it just so difficult. And it is radical, like what you're doing and what we're doing, and there is this kind of level of almost like activism that you have to partake in order to be anti-diet, because it's funny, actually Christy Harrison gave this great analogy, and this is like it's like, she didn't make this up, but it's this idea that, you know, you're at the side of a river and there are all these people in the river, and you're helping them out of the river, you're helping out of the river, but at some point you have to go up the river to figure out why the hell is everyone falling in the river, right? You can't just keep pulling people out of the river. So at what point, and I think this doesn't happen for every clinician or practitioner or whatever, but a lot of people do end up going to see like, what can we do here to fix the system and like to dismantle this? Like, what can we really do? And I'd be curious to know what you think some action steps would be for kind of average people, or
solve
for
the issue for us.
Well, no, but maybe just action steps that you've taken. It's hard. I don't know the answer to it, but just you can just talk about it.
I mean, my first thought with that is just how hard it is, even like as a professional, to talk about it. That I have a lot of empathy for people who, like, I have some level of, I don't know, social respectability, like because I have a master's degree, unearned, but I have it, and that I can say things that, you know, not everybody could say, and it's still really daunting. Like even just to like therapists I know, like it's really frightening, like because you just don't know what you're gonna get, and it's a risk, and you know, it's a risk of people thinking that you're unprofessional or you're a zealot or whatever thing they're gonna think about you, or dumb. And so I just want to speak to that piece of like, I think it's really hard. So if anyone is listening to this who like has a hard time being an activist for all of these things, like that's okay. Like it's super hard and daunting. And I think a huge piece is to talk about it. Mm-hmm. Like, I think that's the place to start, is to start with the people that you have relationships with. And I mean, of course, I'm going to think that my whole job is just having relationships with people. So like, yeah, have relationships with people. But I think that's the place to start, is like to talk to your friends, to talk to your family, to talk to your coworkers, and to advocate both for yourself and for other people. I think one thing that really resonated with me kind of earlier on in this journey is like, I wasn't feeling better. And so one way that I could really dig in to the anti-diet journey was recognizing that I'm hurting other people. Like by holding on to beliefs about thinness being better, by thinking that I should be a certain size to be more valuable, I'm actually setting up a world where there's good and bad people, and just trying to keep myself in the good category. And I would encourage people to think about it in that way, of like, it can just feel really personal and like you're protecting yourself. And sometimes if we feel like we're protecting other people, we can figure out more easily what the behaviors are that we need to do.
That's really well said. And I think it is important to point out that there's a privilege in being able to opt out of diet culture. Absolutely. And that's just not an option for everyone. For many, many reasons, it's not an option for everyone to just say, you're right, like this is bad, like I'm gonna be right. It's like, it's real.
Especially like we're not discriminated against for our size or anything. Like,
well, yeah. And I think one thing I wanted to bring up, sorry, this is like not totally off topic, but one thing to bring up that just, I don't think a lot of people even know about, is like, you can just like refuse to have your weight taken at the doctor's office, like little things like that, where I'm like, just say no, you know, like.
Yeah. Well, so yeah, when it comes to like personal advocacy, because I think there's like the systemic stuff that I'm like, I'm not sure. I'll get back to you on that. But like on the personal level, yeah, not having your weight taken at the doctor. Also, when you go, like you're talking to the nurse saying like, I'd prefer to not discuss my weight today. And the reaction that you get to that is an indication of whether or not that's the right doctor for you. Mm-hmm. So I think people are really worried that it's not going to go well. And I say, like, if it doesn't go well, that's great, because you have decided to fire them. Then you will find a new doctor.
Yeah, and I have you're setting like a precedent, so the next person that comes along,
it might be a little bit easier for the next person. Yeah. And you know, if you work in a place where people are eating together, like if there's like a break room or whatever, like you saying, oh, we're not commenting on what other people are eating, even if it's not you, or if it is you, that if someone's saying, oh, well, you can eat the donut because you're so thin, or if they're saying, oh, are you really having that for lunch? Like to actually say, that's not acceptable. I think a lot of times we want to just kind of walk away from it, which if that's where you're at, that's great and that's sufficient. But if you have the energy to say like, that's actually not cool, like this isn't the sort of place where, you know, like that's not appropriate. And expanding on that conversation or not, but I think having your boundaries be a little bit more public, telling your, you know, family member, like, I'm not willing to discuss my weight while I'm visiting or on this holiday, or like, I think just saying the things out loud makes a big difference. And I think it can help to solidify like the internal stuff. So you start with the internal stuff and you kind of have your little internal walls, and then eventually saying it out loud.
Yeah, I think it's big, like what conversation topics are acceptable, because like my family, no offense, does like to gossip about like everybody else in the family about their weight and stuff. And I've kind of been like trying to start like shutting that down. Like this isn't something I'm going to talk about.
Yeah. And it's hard in the moment. Like it is. And I mean, I was just at a social gathering where there was a lot of like body talk, and I was like uncomfortable, but I didn't find myself saying anything. I just was silent. I literally just became I'm just like, I'm not going to participate in this conversation.
It was not the right audience for a Justine lecture.
Well, or like if it's like anxiety getting in the way or concern about how it's going to go, then one thing that really helps in those scenarios is rehearsal. So do a role play with your buddy of like the person says the thing, and what would you say? What words would you use? What would your body language be? And or if you do it in the mirror, or but saying it out loud, getting your body to say the thing is going to increase the likelihood that you'll say the thing in the moment. So actually practicing it beyond just like, I'm going to say something next time. Like, what are you going to say? In what words? In what tone? That can really help, because you've seen yourself do it. Like, your body has a memory of like, I did that. I said that. And so you're more likely to follow through. If that's, if you've decided it's a good idea.
And you love to talk to yourself.
I talk to myself. I talk to myself so much today. In particular, I had a lot of discussions. But you know what I was just thinking would be really cool on the Facebook group page is to have people come up with just like some script ideas.
Yeah.
Hey, give a scenario and say, if, like what would, like how, like what's a good, something we could say to diffuse or to redirect or just to declare a boundary, and have everyone kind of come up with their own
role play videos.
That would be really, because I could really use that, because I am quite verbose, but I'm also a people pleaser, so it gets really confusing for me sometimes. But honestly, what I thought about saying, which is like probably super heavy, but I just wanted to be like, as somebody in recovery from disordered eating, I can't participate in this conversation. It makes me uncomfortable. And I'm sure that would just shut it down.
But that's appropriate. So like in that moment, you're causing all of the people in that scenario to feel shame. And that's the appropriate reaction. That shame is motivating for them to change their behavior. That shame will help them to learn like, oh gosh, I should feel bad about what I just did, because they should, and not forever and ever. They shouldn't hang on to it and like, but that's what shame is for. Shame is for, I have done something wrong and I need to make a change.
Mm-hmm.
So it's okay if people feel ashamed if you say something like that.
That's a really great point.
I'm just going to yell at them and point my finger and go, shame!
That would probably shut things down pretty quickly too. That party would be over.
And I'm back to no friends.
Oh, Jen, no, we're friends.
I'm just kidding.
Yeah, that's a really great point. And I love that, like, permission to kind of cause that discomfort, because I think that, again, as a people pleaser, which I think a lot of women have that tendency, I'm like, how can I do this so that no one feels bad? But then I just end up feeling bad, right? I'm like, it's okay if I feel bad and uncomfortable, but how can I negotiate this situation so that no one feels bad, but I can still get my point across?
That's what we do as women all the time.
And you're assuming that you're the only one that feels bad about it. Right. But the reality is that probably most of the people walking away from that interaction feel bad about their bodies or themselves, or whether they've been sticking to their XYZ routine after that, like that they're probably not feeling good.
Yeah. I had this similar conversation with a friend recently who was around people who were really talking about body stuff and everything. And she'd made a declaration, she's like, yeah, I'm not doing that. And I reminded her that she could have really just inspired the hell out of somebody, even somebody that didn't say a word, just standing there, because she was in a social situation with a lot of people. And I'm like, you could have like really changed somebody like in that moment. And I know that because when I was making my own declarations around like, I'm not dieting anymore, I'm not coaching with us anymore, and I had a lot of women come up to me that were really thrilled to hear that. And I wasn't expecting any feedback. That's not why I did it. I wasn't like, but to have these people who you would never guess, like it was no one I would have predicted would come up to me and say like, hey, that meant a lot that you said that. And I'm like, wow, like this really means something to somebody. And that actually, for better or worse, was one of the things that kept me from wavering, because after that declaration, I definitely had moments of like, maybe I could just lose a little weight, right? And I'd be like, no, like I really felt like, no, these people are like counting on me, and I don't know, I'm not saying that's a good motivating factor or not, but it was real for me at the time. This was
it matters. Yeah, and it's again that like focusing on how you might be having an impact on other people can be a really good motivator, because it's true. It's like, I think it takes hearing that message lots and lots of times for someone to have it sink in. And that if you were one of those times, you're probably not going to get that feedback in the moment, but you were one of those times. Like you were times 7 out of 10, right? And then once they get to 10, like you got them closer, that it does matter. I also want to say Aubrey Gordon came out with a book, and she does have really specific like policy changes, like things to like advocate for in your communities and legislation. I forget the name of her book, but it definitely had, her name's Aubrey Gordon. She has pieces about that. So if people are like at the position of like, I want to do something a little bit more systemic, she's the pro on that.
Yeah. And Jen always reminds me too, because I'm a bit of like, when we create content and messaging for Soul Sisters, I'm like, well, we're kind of like repeating ourselves. And Jen's always like, how many times are women told to go on a diet? Like 50 times a day. Like we need to repeat ourselves, you know? And so I just love that idea. She's so smart.
I knew somebody who said that, a therapist, and I think this fits for your jobs as well, is somebody who says what you need to hear over and over until you're ready to hear it.
Yeah.
Oh, love it.
Yeah. Okay. That makes me feel a lot better about all my social media.
You're like, stop dieting. Next day, stop dieting.
Put your shoulders down. Put your shoulders down.
Drink some water. You're probably dehydrated. Yeah, totally.
Lastly, I wanted to just talk about, you know, some ideas you had for people if they feel like, you know, dieting is affecting their mental health, and some steps you might suggest that they take.
Yeah. I mean, definitely if you are open to seeing a therapist, that's a great idea, and looking for those buzzwords in their profile, or just asking them directly on the phone what their position is on weight loss, to not put yourself in the position of just kind of re-traumatizing that. Same if you want to see a dietitian, there's some really good dietitians out there that do have an anti-diet approach. And so make sure you're finding those ones and not the other ones, asking for referrals from friends or, you know, people that you know, other professionals. I think really doing an inventory either by yourself or with one of those professionals of like, what do you want your life to look like? Like, what are the goals here? And kind of doing what we were saying of drilling down underneath, I want to be healthy. Like, what does it mean to be healthy? What does it look like? What would I be doing differently? What would I be feeling differently? And seeing if there's some things that rise to the surface, and starting from that point. Like if you're like, I sit a lot and it doesn't feel good and you would like to move more, like great, like sign up for your program, or, you know, go for walks, or like do something in that area. If you are feeling like you're really sluggish and tired, then getting more sleep, drinking more water, like starting with those things that are actually about health, which would be sleep, water, getting some movement in, and nutrient timing. So like if you're skipping meals, then try not doing that, or just experiment with different nutrient timing. Try 6 small meals, try, you know, like making some changes and seeing how they go. I think the concept of experimentation is really helpful, of like, you're not committing to something for the rest of your life. And so trying out a little tiny change and thinking, so you're not going paleo, you're like, what would happen if I ate more protein? And then paying attention. So like tracking what changes and what doesn't, to figure out what your body wants and what it's trying to communicate to you. And then definitely like looking into like intuitive eating practices. I feel like that's just really hard to start with. And so sometimes I encourage people to look at where do you access your intuition in other parts of your life and enhancing that. So some people are really intuitive about relationships and people. They kind of know what somebody's feeling. They know what the right thing is. So like, how do you know? What does that feel like in your body? Like, where do you feel that? Like, what's your, you know, when your spidey sense happens, like what are your first signs that that's happening, and starting to apply those to food. Like we all have intuition, we all have wisdom. And so enhancing that wisdom in other areas and then translating it over, I find sometimes can be helpful too.
That's interesting.
Yeah, I love that idea. And like going to intuitive eating, like you read the book and we were talking about how that first step is like really scary, like reject diet mentality. And it's like, okay, well, I can't go anywhere until I do this completely. And obviously that's like a super long process.
Yeah. And it seems way more complicated than it is when you read the book. And so I think I encourage people to just start with like, do what feels good in other areas. Right.
Yeah, that's a really good point. Cool.
Yeah, I mean, I think we talk about self-trust all the time. We just like have stuff, you know, and that's what dieting tells you to do, is to just like that you can't trust yourself.
Yeah,
absolutely.
And it bleeds into everything else in our lives. And I think that we didn't mention this, but it's a good point about how, you know, every diet we go on and fail, it's not like that failure is compartmentalized. Like, oh, I only think about that when I, you know, no, like it's that our self-efficacy, our sense of self, everything just kind of gets diminished every time it happens. And because diets fail 98% of the time, it's such an unhealthy practice to keep going on. And like you mentioned at the beginning, which I meant to say, because you were like, I didn't really think of myself as a dieter, but it's important to acknowledge that there doesn't have to be like a name or a book written around your way of eating for it to be a diet.
Yeah.
It's truly a mentality, the mentality around the eating. Yeah. This has been awesome.
Yeah. Thanks, Michelle.
Oh my gosh. Thank you for having me.
You're so welcome.
Is there anything else you wanted to share, or
do you have a social media that like, do you have any content that you put out that people can follow you or anything? It's okay. It's okay.
You can call me on my landline and I'd love to talk to you. I mean, I have a website, but it's pretty much just the number to my landline and my fax line. But that's meridiandbt.com is the practice that I co-own.
Okay.
And certainly if you like, even just people who want to talk more about this, not even in like I do not have openings for therapy, I'll say that. But if you would like to talk to me more socially about this, I would love to. I would love friends in the fitness anti-diet world. So feel free to reach out to me.
That's awesome. Yeah. And I think, if you'll have us, then this could be definitely not the last time we do a talk like
awesome. This. Yeah.
Okay. Well, we're going to go off of Facebook Live, but then we're going to stay on. Don't go anywhere. All right, cool. How do I get off of, stop live stream. Here we go.
There we go.
Bye.